Good morning, everyone, and welcome back to NCLEX session. We are now on part 8. My name is Diane Anderson, and I am a professor, and I've been a nurse for over 20 years. And my area of expertise is mainly ICU, PCU, ER, also IMC. I've also done various other things as well, including OC Health, including home care, etc., and etc. There's more details about me on sessions part 2, 3, and 4 if you want to get a little bit more detail about my background. But I think we should just jump right into the questions. Now, these questions I put together, these are more easy to medium. I made the last session, part 7, extremely easy. Hopefully everyone that did those questions just knocked it out without even a thought. But this one, I kept a couple easy ones in there, but I brought you up a little bit with some medium level difficulty, okay? Alrighty, let's jump right in. Question number 1. A nurse is implementing hourly rounding on a medical surgical unit. Which statement best describes the purpose of hourly rounding? Is it A, to minimize nurse-patient interaction? B, to reduce the frequency of vital sign assessments? C, to proactively address patient needs and concerns? Or D, to limit the nurse's availability during the shift? If you chose C, to proactively address patient needs and concerns, you are correct. Now remember, hourly rounding is a proactive approach to nursing care that aims to address patients' needs and concerns before they escalate, all right? Especially something like pain. Pain, you want to control pain when it's at its lowest point. You don't want to wait for pain to get to a level 9 or 10 out of 0 to 10 and then say, okay, now let me medicate the patient. Make sure you also teach your patient that, because some patients are so sweet and they're like, oh, I don't want to bother the nurse. But they don't realize they're not saying something about their pain when it's now reached a level of 4 and 5 and 6 is hurting themselves more than helping them. They shouldn't be concerned about bothering the nurse. The nurse is on the clock. She's getting paid to be there. They should be concerned about their care. And they are part of their care when they press that call bell and say, hey, I need some pain medication. My pain is now a 5 out of 10 or a 6 out of 10. We don't want to wait for it to get way too high. Okay? So that's one example of a concern before it escalates. Remember also, rounding promotes patient safety, comfort, and satisfaction by ensuring that the nurse regularly checks in on the patient, assesses their condition, and addresses any immediate needs or issues. Question 2. During hourly rounding, a patient complains of pain. The nurse reassesses the patient's pain level, administers prescribed pain medication, and provides comfort measures. What is the primary goal of this nursing intervention during rounding? Well, hey guys, I kind of gave it away in the last question. Is it A, to complete documentation efficiently? B, to prevent falls during the shift? C, to address and manage the patient's needs promptly? Or D, to prioritize the nurse's tasks for the next hour? If you answered C, to address and manage the patient's needs promptly, you are correct. And again, just review back on what I said about question 1 for the rationale. Question 3. A nurse is educating a new staff member on the importance of hourly rounding. Which outcome is typically associated with effective hourly rounding in patient care? Is it A, increased patient anxiety due to frequent interruptions? B, a reduction in patient falls and pressure ulcers? C, a decrease in patient satisfaction scores? D, an increase in the nurse's workload and stress levels? If you chose answer B, you are correct. A reduction in patient falls and pressure ulcers. Remember, guys, when you are hourly rounding, Remember, some of your patients are confused. Some of them have Alzheimer's or dementia. Some of them do what we call sundowning at night when the sun drops. They went from being alert and oriented, knowing where they are, what their name is, what year it is, who the president is, all that stuff, to, oh my God, I don't know where I am. Or, oh, I'm back in my apartment. Totally forgetting everything. So a lot of times with those patients, they are at higher risk for falls because they forget where they are. They think they're at home. They're trying to get out of bed to go to the bathroom, forgetting that they broke their hip, or forgetting that they're in a hospital and they're trying to climb over a bed rail, or the floor is slippery, things of that nature. So when you are doing your bedside rounding, you're asking the patient, hey, can I get you something to drink? Are you hungry? Do you need to go to the bathroom? You want to assess and prevent things from happening early on. Okay, so part of that rounding helps you to do that. And in terms of pressure ulcers, when you're in that patient's room and it's a patient that's having trouble turning from side to side, especially someone that had a fracture, they may not even want to turn on that side, or they're afraid to, forgetting that their pain medication has already kind of kicked in and is safe to turn and roll. But those patients, you want to help them reposition. Every 2 hours is pretty standard for most facilities, and that prevents pressure ulcers. Okay? So question 4. A nurse is preparing to administer a trial medication to a patient via the IV route. The medication is available in a vial containing 100 milligrams per ml, and the order is for a dose of 50 milligrams. What volume should the nurse draw up for administration? Is it A, 0.5 milliliters, B, 1 milliliter, C, 2 milliliters, or D, 5 milliliters? If you answered B, 1 milliliter, you are correct. And I simply put a quick little calculation in there for you. So if you look at the screen, you'll see that to calculate the volume, you just want to divide the ordered dose by 50 milligrams by the concentration of 100 milligrams per 1 ml. And the 50 milligrams divided by 100 milligrams per ml equals to 0.5 milliliters. Okay, so since the medication is 100 milligrams per ml, since that's the concentration, the nurse should be drawing up only 0.5 milliliters. Now, if you also notice in the question, I put the words trial medication. Why did I do that? Well, I've been a nurse for a little over 20 years, and from my personal experience, I've only had maybe about 7 patients that were actually on certain studies and trial medications that they had already agreed to participate in before they even came into the hospital. And when patients like that come into the hospital for other ailments, most of the time they still remain on these trial medications. These patients have already signed a form for being a clinical trial participant with whatever pharmaceutical company or whatever lab or whoever they're associated with. And they are now study subjects or trial subjects, and they are receiving clinical trial medication, and they don't know if it is a placebo or if it's the actual medication that they are studying and trying to see the effects on the human trial. A lot of times, again, that does not stop when the patient comes to the hospital. And legally, you can administer that medication as long as you know, and make sure you verify with the doctor and with that patient that they have already signed a form that says that they are truly a clinical trial participant. Because you're not going to know what's in that solution that you're giving the patient. The patient doesn't even know. That is part of the study. Okay, but that is why I use that as an example, because it may not have a name. It could be drug A, drug B, drug C, for a vial A, B, C, okay, without an actual name. Okay, guys? Okay, guys, question 5. A nurse is administering multiple oral medications to a patient. The nurse is aware of the importance of the medication administration 5 rights. Which of the following is not one of the 5 rights of medication administration? Is it A, right patient, B, right medication, C, right time, or D, right color of the medication? Now, come on, guys, this is extremely easy. You should be getting this just in your sleep. So if you chose D, that is correct. The right color of the medication is not one of the 5 rights. Now, just as a quick review, the 5 rights are the right patient, right drug, right route, right time, and right dose. Me personally, I prefer the 6 rights, which a lot of facilities go by, which includes the right reason, okay? Because a lot of times I've run into a few nurses, and including students as well, and you'll say, hey, well, why is this patient even receiving this medication? They're like, I don't know, but the dose is right and the time is right. But that's bad. You guys need to know why you're giving a patient a medication. Sometimes just knowing that one little tidbit can save a person's life, because maybe the doctor meant it for someone else, and they wrote that patient's information, but the reason why they're getting that medication may not be the problem. So knowing the right reason or right circumstance, you may see it written that way, is very important. So I like going by the 6 rights, actually. Question number 6. A nurse is preparing to administer a medication known to have potential adverse effects. What is the nurse's primary responsibility for administering this medication? Is it A, administer the medication as prescribed, B, assess the patient for allergies to other medications, C, obtain the patient's informed consent, or D, review the patient's medical history for contraindications? If you chose D, review the patient's medical history for contraindications, you are correct. A good example of this too, there's been patients that have fallen in the past, let's say in the hospital, and sometimes, remember now, patients have more than one doctor usually on the team. And I've seen a situation once where the main doctor was aware of the fall, ordered the typical head CT, all that other stuff. But there was another doctor that came on board to assist in taking care of this patient and writing orders. And for some reason, they missed seeing that note and had ordered the patient to start on a heparin drip. So the red flag to the nurse would be, okay, the patient just had a fall just like maybe 1 or 2 days ago. And they had, let's say, a bleed per the head CT. Let me double check with this doctor if they really want him to start on this blood thinner, whether it's Coumadin or heparin drip or whatever. Because you never know. Every now and then you might run into a situation where they're like, oh my God, I didn't know, or I didn't see that note, or I wasn't informed of that, or I'm new to this team. I was, referred to this patient, and thank you so much for the information. And then they may cancel that order. So you've now just protected your patient from other complications. So it's important to also look at the patient's medical history, which includes not only previous diagnosis, but also includes medications that they were on, are currently on, and any new things that may have happened, like a recent fall, which may cause a bump in the head or a bump on the hip or an internal bleed at one point. Okay? I hope you did well on those questions, and I hope you understood the rationales. If you had any problems understanding anything, please reach out to me at my email, which you can see on the screen, admin@skillsnacks.org. We are here for you. We also offer tutoring services as well. So just email me and inquire about that as well. We do one-on-one and we do group sessions. Please go ahead and like and subscribe, and forward this video to any of the other nursing students or even nurses that are new, to the field, and you may see something that could help them as well. Okay? Have a great day, and I will see you again back with part 9.